Welcome everybody to GoLocal Live. I'm Josh Fenton, CEO and co-founder. It is Wednesday morning and we've got Dr. Phil Chan, associated with Brown University, also does work with the Rhode Island Department of Health. He's been a frequent guest with us, going way back even before COVID days. Way back then, I didn't even know we had healthcare then. Phil Chan, thanks so much for joining us.
Thank you, Josh.
So Phil, I really appreciate you taking the time, and I hope we make this a regular visit because I think there's so many things developing in healthcare and so much information out there. I really wanted to take a few minutes to talk about this issue of what's transpiring in sort of the weight loss industry, specifically with these development of new drugs, and wanted to get your thoughts on them.
Yeah, thank you so much, Josh. So this is one of the most common things I hear as a primary care doctor. More than half my visits, people come in, they talk about wanting to lose weight, especially with the new year. It's been more common lately. And I'm reminded, of course, that over 2 in 5 adults are actually overweight or obese. So it's a huge public health problem. And I'm very excited about these new drugs, which we'll talk about.
All right, so let's dig in. You know, I know the jingles, the theme songs. I might even know the dances for Ozempic, and they're slick and they're wonderful. And there's a lot of information about it. You really can't read the New York Times or the Wall Street Journal on any given day without reading something about either their applications for diabetes, weight loss, and then new applications. So let's just start with diabetes and weight loss and talk about these drugs.
So first of all, these drugs have received a lot of hype. And as a primary care doc, I am actually very excited about these medications. I have seen amazing results in my patients. I mean, it's typical for a person to lose 5 to 15 to 20+% of their weight on these medications. So what are these medications? They're called GLP-1 agonists. They basically mimic a hormone in your body that allows you to increase the glucose in your blood, right? The sugar, the food that you eat. So it also increases your ability to feel full, resulting in weight loss.
Okay, and you've seen positive results without disclosing anything, obviously, for HIPAA reasons and beyond. How many people have you worked with, and what has been sort of the implications for their health?
So about 25% of the folks that walk in to my office as a primary care physician, I feel like I've prescribed these medications to, with variable success. And that's one thing I think for folks to recognize is that not every drug works for every patient, and that the individual responses really do vary widely. So that being said, I have seen pretty dramatic results in some people, and especially those that have been at heavier weight. I do want to mention, of course, that these medications are really, really good and effective, but they need to be done as part of good old-fashioned diet and exercise. And let's not forget about that, right? These medications are effective, but I also don't want to lose sight and tell people that they really have to do this as part of an approach, a part of a lifestyle change, which also, of course, includes diet, nutrition, and exercise, just being active.
And what have been the downsides? You read, 5% or 10% of folks have some side effects that are impactful, negative. None of us want those type of side effects. Talk about that a little bit.
So as with many medications, the side effects really vary. I will say for these medications, the one thing that I have seen in a not insignificant number of people, maybe 5 to 10%, as you mentioned, are really pretty significant stomach stuff, GI stuff, things like nausea, vomiting, diarrhea potentially, some bloating, stomach pain. And I have had 1 or 2 people, out of a lot of people, but 1 or 2 people say that this is the worst that they've ever felt in terms of stomach stuff. So some of these side effects are real. They're in a lesser number of people, but they do exist. And I think part of it's because they slow emptying of the stomach and it makes you full, you eat less, and people don't always feel great with that. But again, a lot of people do tolerate it well. The other thing I'll mention, Josh, is that these medications are still relatively new. And it's one of my wise old mentors used to say, you never want to be the first person to do something or the last person. And there's always a balance when understanding these drugs. So the best thing to do, of course, is diet and exercise. We're still learning about these medications. They can affect the pancreas. They can potentially affect the thyroid in a very rare number of cases. But again, the most common stuff are those GI upset and things like that.
Let's go to these other applications of these GLP-1s that seem to be, as you said, a little bit of a miracle drug. It's for kidney disease. They're talking about it may have a positive effect on reducing cancer rates. Talk about those applications. I know we're just at the beginning of those, but I do think for the kidney application, it has been approved by the FDA.
Yes, and I've always, there's so much information coming out, to my point that we're still learning about these medications. There are studies that show that these medications have been associated with better cognitive outcomes, improved seizure outcomes, neurocognitive disorders, things like Alzheimer's, dementia, and certainly cardiometabolic and kidney diseases you're alluding to. I don't think that these drugs are going to be a fix everything, et cetera. And I think we're still learning about them, and I'm still a little bit wary about all these other touted benefits. I think the evidence is not there yet, but I'm optimistic. And like I said, I mean, all the data coming out is really quite amazing with these drugs, and especially as related to weight loss.
Yeah, whenever anything new comes out, I always think of the always important documentary movie, The Jerk, with Steve Martin, who invents this thing to take his glasses off, and it is a miracle, and everyone likes it because you don't have to fix your glasses on the side. You can take it off from the middle, and then finds out that everyone becomes cross-eyed, and it is a medical disaster. Obviously, we're hopeful that the FDA does enough rigorous work and there's been enough evaluation to get it this far. But as you say, you're cautiously optimistic. Talk about that, and not only for weight loss, but for other applications.
Well, I think we have to remember, Josh, that science is always evolving and changing, and it's not one study that we usually, all of us in medicine or science, hang our hat on. We really need to see multiple studies in multiple populations across multiple settings to really solidify and really demonstrate that these are effective in whatever you're trying to prove. So this early data, these looking at sort of these associations in one or two studies across different populations are very optimistic and telling, and I think. But I think we also have to remember, right, is that obesity itself, being overweight, can contribute to so many bad outcomes, and simply losing weight may also improve things like neurocognitive disorders, cardiometabolic disorders. So I think it's complicated whether or not the medications themselves will actually improve these things, or if it's a result of the weight loss that people are experiencing.
And then the last question I have is sort of, listen, we're already in this sedentary lifestyle. People, between Netflix and gaming and sort of how people work, there's not enough movement. Are you worried that so many people will go to this drug option rather than, raking leaves and going for long walks and going for runs and back in the gym and all those types of things that not only have a benefit for weight loss and muscle building, but they also have a whole host of other things of interacting with people, mental health, becoming more vigorous, becoming more connected to the community because you're out saying hi to your neighbors?
Well, I totally agree with you, Josh. I think, these medications are really meant for people that have failed doing exactly what you're saying. And I'm reminded, of course, that a lot of people have genetics or other complicating factors that can contribute to being overweight, et cetera. These medications are really only approved for people that fall in the obesity category based on body mass index, which is not a perfect measure, but in general, you have to have a BMI 30 or above to qualify for these drugs, or you have to meet the definition of being overweight with a BMI of 27 or more with one other condition related to your weight, such as having high cholesterol, diabetes, et cetera. So it's not for everyone. And to your point, Josh, I talk to my patients about using this to help facilitate weight loss. Yes, it will help, but yes, you also need to do all the other things. You need to focus on eating right, fruits and veggies. You need to focus on activity. You need to focus on taking the stairs versus the escalator or elevator. And I'm reminded that it is recommended that adults get at least 150 minutes a week of moderate to vigorous activity. So it's about 30 minutes for 5 days, which I think is totally doable. And that's the absolute minimum. At the end of the day, you just want to be active.
And then there was an article, I can't remember where I saw it. I think it was Wall Street Journal, LA Times, that the new big thing in LA is these, after Ozempic, your skin has a tendency to have lost some elasticity because you've lost so much weight, and that you need this $20,000 sort of body tuck to become back to a more less droopy skin condition. Your thoughts on that?
Well, it's one of those things I think that's a little bit of a trap sometimes in terms of getting caught up in body image. For me as a physician, it's really the focus of being healthy. You want to be healthy, both physically and mentally and emotionally. And I think we know that just being active and exercise and eating right really contributes to that. And I think sometimes people fall in this trap of, all these extra procedures, et cetera. And if you can afford them and that's important to you, then by all means go for them. But as a physician, certainly for me, it's about being healthy and reducing the risk of some of these serious, life changing, diseases, things like cardiovascular disease, heart attacks, strokes, cancers, all associated with being overweight.
And then, Dr. Chan, last word from you. If somebody's, been seeing this, been reading about it, what should they do next?
I think if people have really, really struggled with their weight, I think if their weight is really causing significant health consequences in their life, things like high cholesterol, blood pressure, diabetes, it really is worth it to discuss potentially these GLP-1 agonists with a physician, with a doctor, and to consider it as a moment to take charge of your life, to be healthy, to work in diet, nutrition, and activity, as well as with these medications potentially, which are effective at weight loss.
Dr. Phil Chan, always appreciate your expertise. We hope to have you back, get this information rolling out to people. For everybody else, stay tuned. GoLocal's got a significant investigative piece coming out later today. And obviously, if you haven't seen Kevin Stakeum's big piece on the new discussions that are taking place about a potential major blockbuster merger in college conferences, take a look at that. Big East and the ACC, Coach K and Rick Pitino are pushing that idea. Thanks, everybody.